Who changed one word today? From responding to the outbreak to being outpaced by it. On a dashboard, that's the word you watch. If you're just joining us, DRC's Bundibugyo outbreak was already climbing before today. Delayed recognition, uneven lab capacity, and strained contact tracing were all complicating the response. The last figures we had were 956 confirmed cases and 247 deaths, with WHO putting more emphasis on treatment center capacity as a critical part of care.
This is Ebola Watch. Today, the case count breaks 1,100. IOM puts a hard dollar figure on what's missing, and UNICEF gives us a number out of Ituri I can't shake. Let's get into it. If you want to keep up with DRC Bundibugyo Ebola Outbreak, tap follow so the next episode lands in your feed.
Africa Leader has the details on this one. The headline number is 1,118 reported cases. But the line I want listeners to hear today is from WHO itself. They've moved from describing themselves as responding to the outbreak to warning that it's outpacing the response. That's a change in characterization, and on a dashboard, that's the signal.
Yeah, and I'm going to say it plainly, because we've been sitting with this tension all week. The cautious optimism, read from the field, versus the worsening numbers. WHO just put its full weight on the worsening side. This doesn't sound like two responders disagreeing anymore.
And by outpacing, WHO means the climb from 956 to over 1,100 over a matter of days is faster than the system on the ground can absorb. The infrastructure arriving still hasn't caught the curve.
So for the worried American listening, does WHO saying outpacing change the personal risk math at all? Honestly, for a traveler, the answer is the do not travel posture was already the right read. The numbers just confirmed it.
This one's from International Organization for Migration.
Geneva, 23 June 2026. The International Organization for Migration, IOM, today launched a 6-month regional Ebola preparedness and response plan, seeking $55.8 million to strengthen coordinated action across 11 countries following the latest Ebola outbreak in Eastern Democratic Republic of the Congo, DRC.
Okay, here's a number I can actually hold on to. IOM wants $55.8 million for this regional plan. They've got $20 million in hand, so they're $35.8 million short. What doesn't happen when you're that short?
It's the unglamorous stuff that actually stops Ebola. A screening post at a crossing stays unstaffed, a contact tracer doesn't get hired, surveillance on an informal border route simply goes dark. And look at the design. This is an 11-country plan. IOM is treating it as a corridor problem around Congo, the borders where people cross daily for trade and family. That footprint tells you where they think this goes next.
Which lines up with what we just heard. 1,118 cases. WHO saying the response is being outpaced. So the appeal lands in the same week the agency says, on the record, it's behind the curve. The money's trying to catch something already moving faster than the money.
And IOM has already run more than 1 million border health screenings. We're talking about existing capacity asking not to be cut off at the knees by a $35 million hole, not some plan on paper. Here's All Africa.
Although the situation remains fluid, children and adolescents account for approximately 15% of confirmed Ebola cases and over 25% of confirmed deaths in eastern DRC as of 19 June. Children and adolescents with confirmed Ebola are almost twice as likely to die as adults, highlighting the disproportionate impact of the outbreak on younger populations.
UNICEF's number from the 22nd is 2.95 million children at risk across 31 health zones. And I want to hold one line separate from the case count. 130 children orphaned in Ituri. UNICEF is documenting that as a protection caseload right now.
And it's Ituri. Not just Eastern DRC, not a provincial code, a specific place where 130 kids have lost a parent, in some cases both. That's the geography I've wanted all week.
There's an epidemiological edge to those orphans, too. When a caregiver dies, the household exposure map shifts. Contact tracing has to chase a moving target. So the protection crisis and the tracing problem feed each other.
UNICEF also says kids with confirmed Ebola are almost twice as likely to die as adults. And children are 54% of the people living in those zones. The majority of the population in the outbreak area is under 18.
That last figure reframes everything. When the response is being outpaced, WHO's own word now, it's being outpaced in a population that's mostly children. The math is unforgiving. All Africa writes,
More than 2 million forcibly displaced people, including over 320,000 refugees, live in areas at risk in the DRC, where fighting continues alongside the spread of Ebola disease. Fears are growing about population movements into and out of affected areas and their potential impact on transmission, reinforcing the need to align public health with protection interventions.
Here's the thing. UNHCR documents that the case count alone hides. On June 7th, 2,250 people fled Mbao. That's 20 kilometers from Beni, one of the epicenters, and ran straight into Oicha, an Ebola-affected zone already hosting 14,300 displaced people. On the ground, it means people walking from one hot zone into another.
And the mechanism matters, Daniel. Armed group movements triggered the panic, and panic moves people. So the diplomatic and security picture across that border is part of the epidemiology here. It's setting the contact tracing map on fire. Look at what UNHCR is careful to say. None of those confirmed cases were refugees. The risk is high, but the documented count and the fear are two different ledgers, and they keep them separate. I appreciate that discipline.
2 million displaced people in the at-risk areas, 320,000 of them refugees. And that's where the IOM funding gap we covered earlier really bites. You can't screen a moving population with $35 million you don't have.
If you're tracking outbreak response with Ebola Watch, you may also want Hantavirus Watch. Daily updates on the 2026 outbreak, including the MV Hondius Andes virus cluster, CDC and WHO response, contact tracing, and traveler risk. Find it wherever you listen to podcasts. You'll find links to every story we covered today in the show notes. So if one caught your ear, you can follow it there and read more. That's Ebola Watch for today. This is a Lantern podcast.